Actually, this table we call is a confusion matrix. So this is the actually yes and no, and predicted can be yes or no. So this is a yes, it's a correctly predicted. This is a TP is a true positive and false negative. So we predict it's a no, but actually it was yes. So this is a false negative. So this is a false positive because we said it's yes, but actually it was no. So it's a wrong prediction. And true negative, this is correct. So accuracy rate is calculating the all of them, right? TP plus Fn plus Fp plus Tn, and then you are calculating only the true positive plus true negative. That's the accuracy rate. However, the precision will just take a look at the what was predicted, yes, right? Only looking at the predicted yes, how many of them are correctly predicted. That's the precision. So in this case, among them, so among 137 of them, how many of them are correctly predicted? That's the precision. Recall is the different way. Recall is looking at the actually yes, not the predicted yes, and then actually yes. Among them, how many of them are correctly predicted? So out of this is how many is it? 215. Out of 215, 135 are correctly predicted. So accuracy among only them will be 62%. So that's the precision and recall. So this is kind of the couple. If you use a precision, the other one will be the recall. So precision and recall is the predicted among predicted yes or among predicted no, right? So that's the difference. However, the sensitivity and the specificity are a little different. Sensitivity is the same as a recall. This is the same as a recall, right? Actually yeses, among actually yeses, how many of them are correctly predicted? So exactly same as a recall. Specificity is the when the predicted is no, right? Actual prediction is no. Out of the no, the real no's, how many of them are correctly predicted? That's a specificity. So if we calculate the lousy predictor, as I mentioned, right? 95 of them are like yes. So actual yes is 95 of them here, and only 5 here. And then if I predict everything yes, and then I will predict everything yes, right? So this will be the correctly predicted 95 of them. We will not have a false negative, right? But everything I will say yes, but actually these are no's, right? This is a prediction and this is the actual. And this will be 0 because I will predict everything yes. So if you calculate the accuracy, this will be the 100 over 95 because adding everybody's 100, and then this is correctly predicted, so accuracy is 95%. However, if you calculate the specificity, what is the specificity? True negative 0 plus false positive is 5, and what is the true negative here is a 0. So specificity will be the 0% here. Then that's how we captured, even there is a unbalanced data, we can look into the detail. Is it the accuracy rate is high only because there is a lot of yeses? So maybe even though your model is pretty not good model, but still your accuracy can be pretty good. So we have to look into the specificity and also the sensitivity. So specificity and sensitivity is kind of the pair. Right? And then the precision and recalls are kind of paired. That's why the sensitivity and recalls are actually the same thing, but when we use sensitivity, you use a specificity as a comparison. So this is the sensitivity. This is a specificity. And this specificity, sensitivity, precision, recall, and accuracy rate, all of these are widely used in the classification machine learning model when we evaluate how good the model is. Okay, rather than just accuracy, we can calculate the sensitivity and the specificity. And sensitivity and specificity is pretty widely used. The reason is some case the cost of the false negative and cost of false positive can be a lot different. So this is how you calculate the sensitivity, the true positive and true negative, right? So you can calculate the what is the total case is the real. This is a real, right? Actual is the 1. Out of actual is 1. What is the true positive? And the actual is 0. What is the number of true negative? And then you can calculate. This is the among the positive, so this is the sensitivity. And this is a specificity. Right? So still we use the prediction using greater than 0.5 probability or less than 0.5 probability. So imbalanced data will cause the accuracy, and then that's why we have to look into the our model rather than only the accuracy. We will use a sensitivity and specificity, right? So severe imbalance is challenging and may require a specialized technique. So I will just introduce what should we do when we have a severe imbalance data. So sensitivity and specificity depends on the misspecification cost. So if the misspecification costs due to the incorrect predicting the target class are high, then default cutoff 0.5 for the converting prediction into the binary prediction may not be appropriate. So you can change, you can cut off, you can predict a little more yes rather than no, then you lower the cutoff point. if the probability is not only 0.5, you can lower. So I will predict yes if the probability is greater than 0.4. Then you are predicting yes more than no, right? And then you will compare what is the sensitivity and what is the specificity. And if you higher the cutoff, so I will predict yes only if the probability is greater than 0.6, then you will predict yes less, and you will predict no more, right? So in that case, again, you will take a look at the sensitivity and specificity, and then you can change. Why misclassification cost is something like that. When we do the COVID-19 test, what is the cost if we predict yes, even though the patient doesn't have a COVID virus? Maybe he have to take some kind of the pill, the medicine, and he will be quarantined. Yeah, that is also the kind of cost because he doesn't have to, but he was classified as the positive COVID virus. Compared to that, and then if we predict this guy doesn't have a COVID virus at all, but actually he has, then what is the cost? He will go outside and then spread germ everywhere, right? So if you to compare to these things, these days, yeah, nobody care about the COVID virus anymore. But actually, like 2 years ago, 3 years ago, it was a serious problem. So we wanna have we will change the criteria so that even though we can have a false positive, we wanna reduce the false negative, right? So some cases can be opposite. So depending on the situation, depending on the cost of the misclassification, you can change the cutoff criteria. You can increase the cutoff criteria or decrease the cutoff criteria. So this is a transit from the high school to the college. Can be from young adult, has a depression or not. So this is our Y value. Some student college anxiety turn into the clinical depression. So early identification is critical to reducing the depression. So we want to find out using the GPA and attendance and female or male. Again, male or female, you cannot have a male, female, both of them. Because this one, if this is a 0, means automatically that's a man. That kind of rule is still hold because the inside of the logistic regression, actually what we do is this, right? Same as the linear regression. That's why the categorical variable, you cannot have all of them. You have to have one less. Male and female, there's 2. That's why you have to have only 1. And then trying to predict this one, the depression, has a depression or not. As you can see, if you use a cutoff 0.5, accuracy is pretty good. Why is that? Because not many students has a depression. I mean, the number of depression is serious, but the number of students who has a depression will not be like 50%, right? Maybe like 5% or 10%. Most of the student doesn't have a depression. That's why if you have something like that, even though accuracy is pretty good, but sensitivity is just 50%. What does it mean? The sensitivity 50% is actually is a yes. So among the real depression student, right? True positive is just 50%. So if you take a look at only the student who actually has a depression, we just find out only half of them, and half of them will be just released. However, the specificity is on 97% because obviously this is about like a point. No, this is like 3%. So we cannot lose this one. I mean, this misclassification is fine because when we are actually face to face to meet the student, you can easily find out, okay, this guy doesn't have a depression at all, so we can release him or her easily. That doesn't cost a lot of money, but when we miss the student who actually has a depression, that might, you know, that might be way more expensive because he got a pretty low grade, or he might leave the school, right? So early intervention will be critical here. So I don't want to lose this 50%. So what you can do is you can lower the cutoff probability is way lower. It's like a 7%. You only just predict as a depression whenever the cutoff is higher than 7%. You lower the accuracy, you lower the specificity, but you don't lose a lot. Actually, you lose a little bit here and then a little bit here, but your sensitivity increases significantly. So you can try an error and you can find out what is the best cutoff here. You don't have to use a 0.5 always. Right? So obviously this misclassification is fine. We don't lose a lot, but this misclassification can be a serious problem. This is the no depression. This is the depression and no depression. Prediction. This is actual. Right?